Welcome to my channel, Postgraduate. In this video, we shall talk about dengue virus, dengue fever, and clinical features of this disease. So, from now let's start the video. First we'll talk, what is dengue fever? Dengue fever is a mosquito-borne tropical disease. It is caused by the dengue virus. It is among the most common viral diseases. Second question is, what are ways of transmission of dengue fever? Dengue is transmitted by several species of mosquito, principally by the genus Aedes, and a subspecies Aedes aegypti. This species bite mostly during the daytime. Remember, it is not spread by direct contact. Sometimes, the history of travel to endemic area is important. What is dengue virus? Dengue virus belongs to the variety of the flavivirus. This virus has 4 different serotypes, DEN1, DEN2, DEN3, and DEN4. Infection with one serotype provides lifelong immunity for that serotype, but only partial protection against the other serotypes. What are clinical features in dengue fever? Dengue fever usually causes severe flu-like symptoms, such as high fever which can reach as high as 39 degrees C. That fever has phasic pattern. Other symptoms are severe headache, pain behind the eyes, severe muscular and joint pain, nausea, vomiting, diarrhea and rash. What is duration of symptoms in dengue fever? The initial febrile phase lasts 3-7 days followed by remission of symptoms in few days to hours. What a doctor will find on examination of patient with dengue fever. Sometimes the doctor finds a characteristic skin rash that is similar to measles. Some patients might develop bleeding tendency. As the disease progresses, hemorrhagic fever occurs in some patients that results in bleeding from the nose, gums and in urine, named hematuria. All these symptoms are due to capillaries and endothelial damage. Some patients can develop skin bleeding, or petechial rashes on skin, that explain the basis of tourniquet test. Now I will talk about one of the complications of the dengue fever, that is dengue hemorrhagic fever. It is most common in certain type of patients that are infected previously with a certain serotype of dengue virus, after their initial infection with a different serotype of dengue virus. Due to antibody-dependent augmentation of immune response, some patients can develop pneumonia, a serious lung infection. In extreme cases, dengue can cause dengue shock syndrome, which is also a life-threatening condition, characterized by hypotension, difficulty in breathing, and a tachycardia due to plasma leakage after endothelial injury, lining the blood capillaries. What are basic investigations in dengue hemorrhagic fever? First, most commonly prescribed is CBC. CBC is an easily available, cheap and conventional test to see various blood counts. In dengue fever, this report is characterized by leukopenia in which white cells count, WBCS, is less than 5,000 cells/M3, that normally ranges about 4,011,000 cells/M3. Secondly, we will see platelets count, PLT. Report usually shows thrombocytopenia in which platelets count is less than 150,000 cells/M3 that normally ranges about 150,400,000 cells/M3. Third characteristic finding in report is a rising hematocrit, HCT, 5-10%. That normal range is about 35 to 45%. This test simply measures the percentage of red blood cells in the blood. If a dengue patient has a persistently high HCT, and his clinical examination shows unstable vital signs, particularly narrowing of pulse pressure, tachycardia, metabolic acidosis on ABGS, or poor urine output, this is an indicator of active plasma leakage through leaky capillaries. But there should be no evidence of plasma leakage in patient. This characteristically happens in dengue shock syndrome, and this condition signifies the need for further fluid replacement therapy in such patients. The hematocrit level should be monitored at least every 24 hours. The purpose is to facilitate early recognition of dengue hemorrhagic fever, and every 3-4 hours in dengue shock syndrome. That's why we repeat CBC again and again in patients admitted or to foresee complications in outdoor patients. Another antigen detection test based on PCR, polymerase chain reaction, is widely used is NS1. NS1 is detectable during the acute phase of dengue virus infections. NS1 tests can be detected during the first 7 days of symptoms. After day 7, NS1 tests are not recommended. A positive NS1 test result is indicative of a dengue infection, but does not provide information about dengue virus serotype. NS1 antigen test is based on principle of detection of a non-structural protein produced by the cells infected by the dengue virus. This test was first introduced in 2006. It allows rapid detection on the first day of fever, before antibodies appear. Antibodies detection tests based on tests, ELISA, are also there that are serological tests, but antibodies appears some 5 or more days later on. What are complications of dengue fever? In extreme cases, dengue can cause both dengue hemorrhagic fever and dengue shock syndrome that causes circulatory collapse. These both conditions are life-threatening conditions. Other than these two major complications, some patients may develop pneumonia, a serious lung infection, hepatitis, bone marrow failure, depression, iritis, orchitis, etc. Now we will discuss some differential diagnosis which you will consider if a patient comes to you with fever, malaria, typhoid, common flu and many other viral illness due to diarrhea, body pain and bleeding tendency. What is treatment if someone gets dengue fever? Always remember, there is no specific treatment for dengue fever. We always go with symptomatic treatment of patient, whether he is admitted in ward, or getting intensive care in ICU, or is sent for home care. There is no drug, yet designed, that is specific against dengue virus. Even vaccine have not been formulated yet. As a doctor you advise your patient to have strict bed rest, keep hydrated during illness, and healthy diet during illness. What are prevention measures to avoid dengue fever? Rest and relief from mosquito bites in a short form of ROM is the most effective prevention measure. There is a list of simple prevention measures to avoid getting bitten by mosquitoes, such as 1. By using insect repellent. 2. Wearing long-sleeved clothing and trousers when you are outside. 3. Dump the nearby sources for the growth of mosquitoes. Stay safe and protect your family from this viral illness by following these simple steps. Purpose of this video is to educate the general population across the globe. If you like my content, please hit on subscribe. Thank you for watching.